the period between the implantation of the zygote in the womb until the time of delivery as to the significant physiological, metabolic, and even morphological changes that occur in the woman, aimed at protecting, nurturing, and permit the fetus, such as disruption of the menstrual cycles or increasing the size of the breasts to prepare for breastfeeding.
At the next week conception, blastocyst moves to the uterus. The egg is the size of the tip of a pencil. A few days after, the egg cells make groups. Internal cells form the baby, and external cells will be the afterbirth. The blastocyst will lose a protective layer and implanting in the uterine wall. On the 5th week, he measures as of a same seed. The embryo is forming and also the primitive organs. The brain and spinal cord are visible because the skin is translucent. The circulatory system also forms and begins to beat his heart. It is shaped like a tadpole and gets nutrients and oxygen from the newly formed afterbirth and umbilical cord. In the 9th week, the embryo loses the tail. It has extremities, fingers, mouth, eyes, and the ears indication. Measures the grape size and weighs very little.
At week 10, the baby is about the size of a walnut. It has defined features and space where the teeth will be formed. Their tissues and organs grow rapidly. It doesn't have the weaving between the fingers, and nails are being defined and his fingerprints too. He can now open and close his feet and curl the toes. His muscles and reflexes are increased, and he can move his legs and arms. He starts to kick. His brain, nervous system, and intestines grow, and his liver produces red blood cells because the yolk sac will disappear. Meanwhile, he is receiving across umbilical cord blood rich in oxygen and nutrients through a vein, and then 2 arteries carry that blood. At week 12, the kidneys begin to produce urine, and this is to excrete the amniotic fluid. At week 14, the eyes and ears are on their side, and can squint, frown, and do grimace.
Between 15 and 20 weeks is baby doubles in size, and the body grows nervous system will mature rapidly. This will connect your brain to the rest of the body. The nerve branch of the brain from the brain stem down of the column and then to the torso and extremities. The skeleton of the baby is shining, harden the soft cartilage and bones become starting with arms and legs. Sensory development at brain accelerates the same special areas for the smell, taste, hearing, sight, and touch. In this stage, the baby can hear the voice and the heartbeat of the mother. By week 18, his movements are more obviously flexing his arms and legs, flapping at the first soft but will be stronger and more frequent each week. At 20 weeks his baby weighs about 200 grams and measures about 25 centimeters from head to the heel, has rolling the leg of a banana and represents half of the pregnancy.
At 21 week, the sense of touch and fingerprints appears. If you talk to him and touch your abdomen, he will move. He can touch his face and the umbilical cord. He is refining his touch. At week 23, slows and can suffer hypos. It is so normal, even at several times of day. Bronchioles starts to form in the lungs and starts breathing and inhaling amniotic fluid through his lungs. At week 24, the baby can live outside the womb with a lot of medical help, and at week 27 his eyelids open reflexively, but he still cannot see. He already has lips and taste buds on the tongue. He weighs about 900 grams and measures 37 centimeters.
This is the last quarter. At week 28, the baby weighs about 900 grams, and his weight will be tripled to until birth, and he will produce a layer of fat to maintain his temperature. His bones have ossified, excluding his skull bones that have not joined. In this form, the baby can pass through the birth canal. Billions of neurons are making the connections that will help him to learn. The baby can now open his eyes and he can see the light coming in. He can also listen. Shortly before birth will fall off small parts of vernic gaseoso. That is a white substance that covers him like a protection from the amniotic fluid. At 37 weeks, his skin is pink and smooth. He increases about 30 grams per day, and his weight is about 2 kilos with 700 grams. Before birth, most babies turn in this form will remain with his head in the pelvic area while preparing for the partum. In the weeks before delivery, reduce the body's production of progesterone and increase as prostaglandins hormones that soften the cervix and oxytocin which cause contraction. Real labor contractions are rhythmic, painful, and increasingly strong. Vertical uterine muscles tighten, opening the cervix while the top of the uterus and relaxed weighting push the baby down. The mother can eject cervical mucus plug, have child the uterus for 9 months few days before or during the partum. When the amniotic sac breaks, the mother may notice a trickle or liquid spurts. The cervix will soften and refine them to dilate 4 centimeters. The body enters the active phase of labor, where the contractions are stronger and followed. At 8 centimeters, the most painful part of labor begins, is the transition. At 10 centimeters, the cervix is fully dilated and started labor, so the baby will drop with each contraction. The soft bones overlap his head to pass through the birth canal, and the baby head can be visible. Then will face, shoulders, and body.
Paramesis gravidarum, it is called gestational nausea, and vomiting is pregnant women present, involving severely produced dehydration, weight loss greater than 5%, ketonuria, and metabolic and electrolyte imbalance gravidarum. As a nausea and vomiting common is pregnant woman, hyperemesis appears around 5 weeks and resolves before 20 and generally prevents the affected woman eat foods and liquids properly.
The cause is unknown, but they attributed an adverse situation of hormonal change, including human chronic gonadotropic. It also been associated with high levels of progesterone and estradiol. In the past, it was believed that the reaction of this was because of an unwanted pregnancy or some other emotional psychological problems. The signs and symptoms usually are lost weight, and that it's more than 5 to 10% of the usual body weight. This woman feel tired and dizzy, usually decrease the urinary frequency, and this is the reason because they are in danger of a dehydration. Dehydration can use symptoms included headache, palpitations, and confusion. There are also risk nutritional deficiencies. And also the boys that has this type of mothers have a risk to suffer complications on the birthday.
The danger of disease is alkalosis or acidosis and dehydration, which are correct with infusion of water, glucose, and electrolytes. The patient is usually hospitalized and kept in bed rest for 24 hours. Intravenous hydration includes electrolyte supplements because the persistent vomiting often leads to a deficiency of this. For the same reason, is indicated the supplementation of thiamine or vitamin 1 for 2 weeks. After correcting the vomit and dehydration, the patient can begin a soft diet with small meals at frequent intervals. Okay, the drug most commonly used is Benedictine and ondansetron, but the ondansetron is so expensive. And also we can use antihistamines and corticosteroids, but in some cases, some women don't respond to any treatment.